Hi, I am back for part 2 of AMP1 review of all the muscles on our handout. Not by any means a complete list, since we know we have over 600 muscles and we are not going over all of them, not in this lab. However, everything on your handout I shall review, and I'm videoing this to assist you. Hopefully this helps. We left off with the abdominal muscles. We're going to go on to the deltoid muscle. So the deltoid muscle, you can see very prominently right here. That is the deltoid muscle on the model. We also have an arm model, superior limb. So here's your superior limb, and there's your deltoid muscle. Okay? Deltoid muscle. So next week, if I put a sticker on this, you should hopefully be able to identify that it is the deltoid muscle. All right, so that said, the deltoid is an asterisk. What does that mean for you? It means that you have to know origin, insertion, and action. That's what. So it's on page 204 in your book. And on the origin, it describes lateral 1/3 of clavicle, acromion, and spinous scapula. So we're going to say clavicle, acromion, and scapular spine. Keep it simple. And then from there, we're going to go over to what the insertion is. So let's go back to the bone. And please remember, deltoid tuberosity of humerus. So whether that was on the practical or not, doesn't matter. Deltoid tuberosity, it's very difficult to find the tuberosity on the bone, but it's basically shaft of the humerus, okay? Action, if you've ever seen a gymnast, a male gymnast on the iron cross, holding the entire body, okay, on the rings. The entire body is held by the deltoid muscle. How amazing is that? So that is abduction, away from the midline. Abduction, A-B-D-U-C-T-I-O-N. So abduction, that is its main, it's the prime mover of abduction, abduction. All right, so in the book it describes the action as acting as a whole, prime mover of arm abduction. When only specific fibers are active, it can act as a synergist in flexion, extension, and rotation of arm. So what does that mean for you? For your understanding, for the practical, for any test, forget about all that. Remember that the prime mover is abduction. The deltoid, the prime movement, it is a prime mover for abduction. Okay, everything else, put it aside. Yes, shelve it, understand that it can do other things. You know, some of the fibers will get together if your muscles are getting fatigued to do flexion, extension, and rotation of the arm. Okay, and you can feel that when you're rotating your arm. You can actually feel the deltoid doing all that. But the main action is abduction. Okay, so if you want to develop your deltoid, use weights and lift and lift. Isotonic contraction is movement. Holding is isometric contraction. So therefore, when you're doing the rings and holding in the iron cross, holding your entire body, that's isometric contraction and firing, consistent firing of the deltoid muscle. All right, so that was the deltoid. We move on to the back muscles. Next one is going to be trapezius. So let's go to trapezius. All right, there it is, trapezius. All right, looks like a diamond-shaped muscle right there, trapezius. Okay, trapezius. What can trapezius do for you? Oh my gosh, quite a whole lot. All right, so let's see, trapezius, unfortunately for you, it is in an asterisk, which means you need to know origin, insertion, and action. So let's go over it. The book says occipital bone. Wow, look at that. It is so big that it starts in the occipital bone, back of the skull. It goes down the ligamentum nuchae. That's another ligament down the neck. Don't even worry about that. Spines of C7 and all of the thoracic vertebrae. So here's how I would put on your index card, because remember, you're still doing them, right? Occipital bone, spines of C7, and then put T1 to T12 thoracic, because it says all thoracic. So just put T1 to T12, T1-T12. All right, insertion. Insertion is going to be, let me pull out the scapula. Hold on, give me 1 second. I'm pulling out a scapula because it's important. Oh, that was a sacrum. It's important in having a visual when you're learning origin and insertion. Here's the scapula. Do you remember the acromion? Yes, you do. Of course you do, right? Acromion and coracoid. Well, acromion and spinous process of scapula and lateral third of clavicle is the insertion. So, spinous process of scapula, follow it to the end, it's the acromion. So basically, your trapezius insertion, remember it started out at the occipital region and the cervicals, all that, and thoracic. Insertion is the entire spine here, all the way to the acromion. And, of course, the lateral portion of your clavicle. So that is insertion. All right, what can it do for you? Quite a lot of things. So you're going to put origin, insertion. For action, you're going to put extends head. So if you want to figure that out, place your hand behind your head, and you can feel the trapezius contracting when you raise your head. So it raises, rotates, and retracts your head. Let's see, no, sorry. It raises and rotates your head. Scapula, it retracts the scapula, adduction, and stabilization of scapula. So how do we shorten this? Short and succinct. Raises head, stabilizes, raises, and retracts scapula. That's it. So to repeat, extend head, raise, rotate, retract, and stabilize scapula. Raise, rotate, retract, and stabilize scapula. That's a lot to remember, I know. All right, so that's the trapezius muscle. What's on your list next? Let's go over it. Next on your list, gluteus maximus and medius. And yes, there is a minimus, but guess what? You don't have to know it for this lab. So I'm going to tell you what page Maximus is on. Gluteus maximus and medius is found on page 216 of your Marieb edition 13. All right, let's get the model out. I'm gonna put these bones away. Pull this guy out. Ta-da! This is the gluteus maximus. Now, if I pull this rubber band down, I'm going to be able to take the outer portion off, so you can see that the medial portion, whoops, and I dropped him. Okay, so if you see him separated, gluteus medius is deep to it, all right? Deepest is gluteus minimus, and then you've got the piriformis, external and internal obturator gemellus and all that. We don't need to know that. So just please remember gluteus maximus and gluteus medius. All right, regarding the trunk model, I'm going to bring it to you so I can show you what it's going to look like on the practical. Give me 1 second. All right, so on the practical, we could say, take this hook off and move this aside like this. I'm not going to take it all the way off, but if we look at this, guess what? This would be medius, all right? And minimus is under there because these are the really deep, deep muscles, the external hip rotators, which you don't have to know about for now, okay? So gluteus maximus, I just spanked him. And gluteus medius, those are it. Let's go over it. Origin. So origin is going to be the ilium. So let me pull out the hip bone, ilium. So remember the ilium and the iliac crest. So for gluteus maximus, you're going to say dorsal ilium. Sacrum and coccyx. Obviously, you know the coccyx bone. Sacrum, coccyx. All right, so that's origin. Insertion, gluteal tuberosity of femur and the IT band. All right. The IT or iliotibial tract, there it is. And what else? Gluteal tuberosity of the femur. Let's see, where would that be? So you can probably, on this model, you can't see it, but it's basically along the shaft of the femur. That's not seen very well there. Okay, so what do you need to know? Very important, powerful hip extension. So for me to stand up from seated position, it's my gluteus maximus. So if you're doing squats, you're working the gluteus maximus because you go from flexion to extension of the trunk. So it's the most powerful extensor in the body. So the book will describe it as complex, powerful thigh extensor, mostly effective when thigh is flexed. So that's why when you're sitting and then you stand up. In climbing stairs, but not as in walking. All right, forget all that. Just remember powerful extension of the hip from seated position to standing. Put in parentheses for the action squats. Now, it does one more thing that ballerinas and dancers know and gymnasts. When you externally rotate your leg, okay? So in gymnastics and in ballet, you're always externally rotating, all right? So it's going to externally rotate your thigh. And so the book will say lateral rotation and abduction of the thigh, all right? So lateral rotation, that way, okay? Lateral rotation, external rotation of the thigh. The other thing that it does is, if you recall, if you're doing this, so that's why dancers have very prominent gluteus maximus, because they're always abducting, and their foot is turned out. So obviously they're going to externally rotate the whole inferior limb and abduct. So this is a typical movement all day long in gymnastics and dance. You're going to abduct that way. Okay, so that is everything you need to know about gluteus maximus. So what does it do? Hip extension, external rotation, and abduction. Again, why am I going over this? Well, according to this, you really need to know gluteus maximus. Medius. Medius is going to rotate medially. Medius rotates medially, so it's not going to do the same thing as maximus. Just because it's next to it, deep to it, it doesn't mean it does the same thing. So let's go over medius. Medius is going to have an origin of upper lateral surface of the ilium, upper lateral surface, and greater trochanter. Remember, greater trochanter, lesser trochanter. So greater trochanter is the origin, greater trochanter of the femur. So again, is important to remember, ilium is the origin, insertion, greater trochanter of femur. One more time, origin, ilium, insertion, greater trochanter, femur. Now, it does have one similarity to gluteus maximus. It abducts, it abducts, but instead of abduction and external rotation, it's abduction and medial rotation. Okay, so if I'm standing up, it's abduction and medial rotation. Okay, so that's the difference. Gluteus medius is a little bit different than gluteus maximus. So gluteus medius, abduction, medial rotation, thigh. All right, I move away and I start the upper limb right here. So let me get to that page for you. Bear with me. Quite a long video. I apologize ahead if you're watching this video. Oy, oy, oy. Okay, so we went over deltoid already, so there's no point in going over that. So let's go over biceps, triceps, brachialis, brachioradialis, flexor carpi radialis, and I believe extensor carpi ulnaris. Those are all the muscles that we're going to go over. Yep. Okay. So let's start with the triceps. Everyone knows the triceps muscle. So you learned in the front, everyone knows the deltoid, and this is your biceps. It has two heads. There's your hand. If you go posterior, here's your elbow joint. You have three heads here, three bodies. Okay, 1, 2, and 3. That's why it's called the triceps. Okay, so just look posterior and you will find the triceps. This is quite a lot of information regarding origin and insertion. The long head, the lateral head, and then the medial head. So I would say be as short as possible. You might not be asked this question, but I will give you the information. Long head, origin, glenoid cavity. Lateral head, posterior humerus. Medial head, put distal radial groove. Okay, on the posterior humerus. Regarding all three muscle bellies, they all come together and insert on the olecranon of the ulna. Action, well, if the bicep flexes the forearm, the triceps extend the forearm. So forearm extension is what it does. So put prime mover, forearm extension. All right, now we move to the biceps brachii muscle. This muscle, you need to know origin, insertion, and action because it is highlighted on your handout. So let's go over it. Biceps, it has two heads. There it is, 1 and 2. And it does forearm flexion. Forearm flexion. So let's go over in your book. It is located on page, where are you? .210. So the short head is going to be the origin. The origin for the short head is going to be the coracoid process. Do you remember acromion and coracoid process of the scapula? So look, acromion, coracoid process. Okay? So for the biceps, the short head is coracoid process. The long head is going to be glenoid cavity. Remember that? Glenoid cavity is the short head. And the tendon of the long head runs in the intertubercular sulcus with the capsule of the shoulder joint and finally inserts. The distal insertion is going to be the radial tuberosity. The radial tuberosity. Okay, and then for action, you do have to know this in quite a lot of detail. Flexion of the forearm as well as supination. So if my hands are pronated and I go to supination, my bicep is going to work that action, okay? So what are you gonna write for action? Flexion of forearm, supination of forearm. That's it for biceps brachii. All right, we move on to brachialis. So we talked about the biceps, we talked about the triceps. Now look, if you see the three bellies, 1 muscle belly, 2, and 3. That's your triceps. And then you see the 2 muscle bellies in the front. Here, I got my fingers on it. In the middle, laterally, right there. Do you see it? That's brachialis. Then if you look at the forearm, this large muscle right here, that's brachioradialis. So this is brachialis. Let's go over brachialis. Brachialis, distal portion of anterior humerus. So if you've got your humerus, distal portion, anterior humerus. This was posterior, so we're talking distal portion, anterior humerus. I hope that helps showing you the bone. Distal portion, anterior humerus. Insertion, coronoid process of ulna. So remember the C-shaped, I'm not going to pull it out, but you remember the C-shaped portion. It looks like a wrench, the ulna. So it literally attaches to that upper C, the coronoid process of the ulna. So what does it do? It is a synergist. So we talked about biceps brachii as a powerful forearm flexor of the forearm. Well, And a synergist is a helper. So the brachialis and the brachioradialis together are synergists, and they flex the forearm. So what you're going to write for action of the brachialis is flexor of the forearm. Next on your list is brachioradialis. Brachioradialis. So here it is, brachioradialis. Okay? Brachioradialis along with brachialis. Brachioradialis, brachialis, which is in between biceps and triceps. Brachialis and brachioradialis, why do I put them together? I lump them together because they are synergists in forearm flexion. Let's go over origin and insertion. Origin, we're going to say distal end of humerus. Okay, lateral ridge, distal end of humerus. And then base of radial styloid process. Everyone knows where that is. You find your styloid process, thumb side, which is laterally if your hands are supinated in anatomical position. So that's your styloid process right there. You can feel it. So that's the attachment or insertion. All right, what else? With brachioradialis, like I said, along with brachialis, brachioradialis is a synergist to cause deep forearm flexion and assist biceps brachii. All right, we leave that and we go on to only 2 forearm muscles, thankfully, that you have to know. That's it. Okay, let's go over them. The first one is Flexor Carpi radialis. So let's take a look and remember your name. Your names on these muscles describe origin, insertion, and action many times. So Flexor Carpi radialis can be found on page 211 of your book. At the top you see the chart, and at the bottom you see the drawings. So let's go over on the model where this Flexor Carpi. So flexor side is going to be the palmar side. So everything on the palmar side is going to be flexion. If I pronate my hand, everything on the dorsal side is going to be extension. Another way you could look at it is what? Anterior, posterior, or ventral side, dorsal side, okay? So flexor side is the anterior or ventral side. Flip it over, dorsal side or posterior side is extension. If you remember that rule, you'll remember Flexor Carpi radialis and Extensor Carpi ulnaris quite simply. All right, so therefore, that said, we're going to look at this forearm. There's your thumb. You're going to look for Flexor Carpi radialis. It's going to go to the radial side. It's a first layer muscle. And it's very simple. It's basically easily visible here. If you look at the picture, Flexor Carpi radialis, I don't know if I'm going to be able to show it to you, is dead center. Dead center, all right? So these are all flexors, but dead center is Flexor Carpi radialis. So look for the muscle, dead center, boom, Flexor Carpi radialis, all right? What else should you know? Flexor Carpi radialis is going to have the action of powerful flexor and abduction, meaning away. So it's that way. All right, so it looks like the queen hello. So flexion and abduction. All right. I'm not going to go into too much detail, but you know, I will provide the information for you. Anyway, it's the medial epicondyle of the humerus as well as the base of metatarsals 2 and 3. So origin, medial epicondyle of humerus for origin, and for the insertion, it's metacarpals 2 and 3 base. We move on to the last one, thankfully, Extensor Carpi ulnaris. Extensor Carpi ulnaris is on the next page. Extensor Carpi ulnaris is going to be the muscle origin, lateral epicondyle of humerus, and then insertion is going to be base of metacarpal 5, And what it's going to do is it's going to be the antagonist to Flexor Carpi radialis. So the antagonist to Flexor Carpi radialis is extensor carpi ulnaris. So we're going to extend and we're going to adduct instead of abduct. All right, so let's find it over here. Extensor carpi ulnaris. Look at your picture and you will see it on page 211. So extensor carpi ulnaris. Extensor carpi ulnaris. There it is. Extensor carpi ulnaris. Okay? So find extensor carpi ulnaris on the model and you'll be just fine. Okay, I think I'm gonna stop here. I'm getting very fatigued. I'm gonna do the next video, number 3, all lower extremity. And that'll be that. It'll be finished. So it'll be muscles in 3 parts, okay? All right, I'll see you on the next video. Bye.